question, maybe we can ask it as a separate question. Maybe imply that as the consolidators are consolidating, there maybe is less interest in investing or perhaps even buying smaller companies because it doesn't move the needle. And I think you said that.
I've certainly heard that.
So from my perspective, we're a mid-cap company, but we still look at the small. The perception is your own internal R&D gets stale at some point or stagnant. Right? They're rest on their laurels. They're not as creative. They're not as risk-taking. So we still look at the smaller, earlier stage companies as a potential R&D, right? We're buying, our team is incapable of doing this with the restrictions we as a bigger company put on them, budget and otherwise. So we're gonna go out and buy this product. So it's gonna move our needle from a top line to bottom line. It's gonna fill a hole in our product portfolio that we can't fill internally with our own development machine. So I think from my perspective, there's still an incredibly vibrant market among the bigger strategics to do that for technologies.
Yeah, I mean, I think Kevin's right. I think there is still a market to it. Not everybody's doing it. Everybody has their own view. I've had some, I think Boston Scientific still has a very active venture group that has their reasons why, when they think it's a technology that they think they don't or won't get funding for internally, and somebody's already sort of got a jump start on it. We'd love to use this as our way to be close to it, to understand it, influence it, see where it could go. Baxter's still out doing a lot of talking about what they can do to help fund little companies. So I agree with you. I think it is there. I think some of it. I had Stryker say to me once, we don't grow new technologies and markets very well. So what we feel like we do well, I mean, you guys can all decide whether they actually do it well or not. But what we feel like we do well is integrate them once it's a good idea and it's commercial. So I think to some extent, some of them just realize it's not a skill set, this early development, real hardcore clinical trials, and do something new in a new market. It's not something they all want to play in, maybe in a certain space within one of their verticals. And so I think they see that as an opportunity for someone else that's going to do it well and be committed to it, that this gives us an arm into. So it really comes down to, I think, the space, the technology, and which partner would it make the most sense for.
Yeah, I think they're still looking to be involved with new, novel technologies to keep themselves aware of what's going on in terms of the space and what creative ideas are coming out. To me, if there's a friction point, it's not so much are they a source of initial funding, maybe not A. I don't think there's too many of them that do angel type investing, but B and C rounds. I think the friction point is more when you would expect to be taken out. And the point Kevin was making about moving the needle, I mean, $100 million doesn't move the needle for Medtronic anymore. I mean, even before, it's been almost 10 years since I was there. I mean, $300-400 million barely moved the needle, and it might move the needle for a business unit. So I think that's where, a lot of companies are thinking, well, okay, if we get a revenue ramp going, 25 million, 50 million, that's when your exits can start happening. That's where I think the consolidation, the consolidators are changing that market. $100 million doesn't move the needle for these guys anymore. So unless you have a really scarce asset, which was really I think what we had with Lutonix, was we had a very scarce asset pre-revenue that companies realized was a scarce asset. They didn't want to lose it. That enabled us to get to a very nice exit. But if it's not an extremely scarce asset, then I think they'd rather pay a lot more once you've proven that you can build the revenue stream, and then they can acquire it for more money, but it actually moves the needle for them.
Well, and Kevin, to your point, I think there's this perception or misperception sometimes of who the strategics really are. Is it just the Medtronics and the Boston and the Abbotts of the world, or is it sort of more, should people be thinking about the mid-cap kind of companies like you're at and others that and that's the issue in my mind.
Well, in private equity, right? So private equity has they have portfolio companies generally that are in the pre-public, they're, usually not early stage, they're revenue, many of them are in that, 20 to several $100 million stage, and they're still held by private equity. And I think private equity sponsors are very keen on looking for those kind of technologies that tuck within a portfolio company to do the investments, right? They're not Medtronic, I agree, but there's a ton of private equity out there. Many of the good ones have exited medical device, but there's still private equity out there. And I think those are, I get it, I mean, they're the financial buyer strategics now, right? That's because their portfolios are the strategics, they're the financial buyer, but their portfolio companies are not good strategics, and that's how they're looking to grow their portfolio companies. So I still see a pretty vibrant market there.
Well, and I don't have any direct experience, but it seems there's a lot of foreign strategics that are starting to come in and do things that we always used the term